for people that don't know me, my name is Gabe Charbonneau. I'm a family practice doctor in Montana. And Subha and I have become friends with our shared interest in tech projects, specifically physician-led innovation projects. And we're both passionate about doing these things, and also have realized that we have some common pain points and challenges. And so that's what we really would like this conversation to be about. And I know I was sort of just now jabbering a little bit about my company, Fluent, but don't worry if you kind of just caught the tail end. We'll go over a little bit about who each of us is and what we're doing here. And I actually, Subha, I would love for you to go first and tell us a little about Trekit, what it is, why you're so passionate about it, and just maybe your introduction. And I wanted to ask you a few questions, but I thought I would volunteer you to go first, if you don't mind.
No problem. Yeah, thanks. So I'm really excited to talk about this because it's, I read your Kevin MD article today, and I think so much of what you said really resonates, which is that those of us on the front lines and actually working in the hospitals or in clinical settings and taking care of patients, and we see the challenges, come up with great ideas about how to make it better. And it should be easier for us to actually act on those ideas and get them out into the world. So I think we have shared histories there. But so I'm a hospitalist. I'm also an informaticist. I've been at Penn since residency in 2004. And honestly, I came into residency thinking I would do cardiology or pulmonary critical care medicine. And what actually veered me off into the informatics pathway is that as an intern, I was kind of shocked that we were managing all of our work on Word documents. So we had an EHR, we had a separate inpatient EHR, separate outpatient EHR. But the reality is, and this is the standard everywhere, is that we still manage our hour-to-hour, minute-to-minute work on paper lists, whether they're rounding lists or handoffs. And then we spend all this time transcribing information onto paper and putting it back into progress notes. And I just realized that the inefficiencies were so significant that, number one, they needed to get better. And number two, it really was adding to delays in communication and errors. And that's probably the biggest thing, is that just the systems of how we work as a team around patients is oftentimes just broken and not working well in medicine. And I really wanted to create a way for us to collaborate better as clinicians around the patient, and not just the doctors, but the nurses, the therapists, the pharmacists, everybody. So as a resident, I built with our IT department a web-based handoff tool instead of our Word document. So at least we didn't have to wait at one computer to get to it. And this web-based tool would bring in some information from our inpatient EHR, from our outpatient EHR, but it was still largely paper-based, meaning we would still print and carry around paper all day. But that tool was very quickly adopted by all of the medicine residency program, and then family medicine and psych and neuro. And people would say to me like, oh, this has saved me so much time. And that was my aha moment for becoming an informaticist, which was that I realized that my ability to improve care was exponentially greater through technology and systems-based improvement than it was through direct patient care. And I still value and enjoy my direct patient care, but I really wanted to kind of just make things work better. Yeah. So I ended up joining faculty at Penn after residency as a part-time hospitalist and part-time physician advisor to our IT department. Ultimately, I became an associate CMIO for the health system, but really kind of served this function of bridging a gap between frontline clinicians and how we provide care, and our IT department and how we develop our tools, and really kind of bringing the knowledge around workflow. So Trekit is actually the third tool the third handoff platform that I made for Penn. And the big difference between Trekit and the prior two platforms that I made is that the original goal was actually to make it fully electronic with a mobile first option so that we could get away from paper. And I'll be honest, and when I first heard the idea, our CMIO was like, we should get rid of paper. I was like, you're crazy. We can't do that. Which I think is a lot of people's reactions when I tell them. But, through user-centered design and a lot of focus groups, I realized that it really not only was possible, but we could do it well. And long story short, we implemented Track It at Penn, not just as a mobile handoff tool, but realized it's actually a mobile workflow tool, replacing the rounding list and the handoff and the progress notes, or I should say, helping generate our progress notes for the EHR. But also integrating with the EHRs and making it easier to find the data we need, vitals, labs, meds, all these things that we waste hours every day trying to find. And it took off very quickly across Penn. So it's been in use for 5 years on all of our inpatient services, from medicine to surgery to Florida ICU. And honestly, I didn't build this with the intent of starting a business. I built it as an internal project to meet an internal problem and to make care better. There's a lot of benefits to be able to build something inside a health system, which is, I wasn't worried about trying to sell it. I wasn't worried about trying to make investors happy. I was just like, what do we need to do to improve care?
Yep.
And I mean, you ask this, like, that's what drives me, is making it easier for us to do the right thing, making it easier for us to take great care of patients, and ultimately result in less errors and better patient care and outcomes.
Yeah.
So really the success of the platform at Penn, and I would talk about it at conferences and people would say, how do I get this? How do I bring this to my hospital? And I realized after a couple of years of trying, to have Penn's tech transfer office do it, I realized it really needed my full-time attention.
Mm-hmm.
So 2 years ago, I finally said, okay, I'm going to do this, and took a lot of soul searching, and we can talk about this some more,
Mm-hmm.
but I really felt like I was going to the dark side by starting a business and going into industry. I felt like I was selling out by trying to do something that wasn't just patient care or anything that had anything to do with business. And I had no business background, and I really had to soul search and realize that, and I still remind myself of this, but I think that there really has to be a balance between academic innovation and research
Mm-hmm.
and industry. And we can have, and we do have, like your story is a perfect example. We have all these great ideas, and we build these tools, or we build these processes, we do these QI projects and impact care in our microcosm.
Yeah.
We should be able to get it out into the world and make things better. And there's such a, all too often, too much of a, this resistance that we're kind of doing something bad by going into business, that it oftentimes holds us back. So
Yeah.
I started the business really to try to get this into other people's hands, because I know it's improving care. I know it's improving clinicians' experiences providing care. And
Yeah.
I mean, when people tell me they can't imagine working without it because it makes their life better, I'm like, that's why I do this.
Yep. Yeah. Oh man, it's like I feel like I could have told that story and just changed a few of the characters and a few of the plot lines along the way.
Yeah.
Except I never I never jumped full into to doing the tech CEO job, and actually that was one of the things I jotted down for something interesting to discuss, which is multiple times on my path that's come up as a, like, hey, if you want to make this work, you need to quit medicine, and you need to lead this company and be the full-time leader of this company. And I actually identified that as a barrier for myself, because so I admire your willingness to do that for sure. But I wonder if part of the challenge is there are a lot of us that, like, you dedicate so much to become a physician, and there are parts of it, there are parts of it that are insane, right? Like, it's okay, forget it, I'm happy to be done with that. And the things that drive burnout and stuff. But there are parts
Yeah.
of it, the patient care, the things that, like, when you were a kid imagining being a doctor, like, there are parts of it that you love. And, like, people still, I've had some opportunities that still, like, have a lot going for them, and I'm not ready to part ways with practicing. So I practice 3 days a week and have 2 days for working on other projects that I'm passionate about, which works really well for me. And I think I've sort of had to recognize that also in some ways is a limitation on the potential of where this can go with innovation. I'm wondering if, sort of you had to similar thoughts, or had to cross that bridge in the same way it sort of sounds like.
Yeah. It's funny on so many different levels of what you just said. So I tried at first to do this part-time. very part-time, and realized that it just, I there's no one that's going to be as passionate about it as I am. And it's going to take someone who's really passionate about the problem that we're solving and understanding the process and really driven to put their all into it. I realize, at least for my project or my business, to make it work. Um, it was a big decision, and I wasn't ready to do that at first. It took a lot of, talking to mentors and getting advice from people. And I kind of thought that there were two paths. One was I give it to another company. I am a advisor and I let them do it all and I stay academic, or I do what I've done. And I got really great advice from someone who said, if I, basically, where do you see yourself in 10 years in your career? And I didn't have an answer because I was so focused on how do I keep this platform going to provide better care. I never thought about what I wanted as a career, and realized that, after I had been here for 10 years, and so my growth potential was kind of plateauing. And
Mm-hmm.
honestly, there's a lot of privilege in my being able to do this because financially my partner is able to support us. And so I had the flexibility to do that. I think that's often the rate limiting step for a lot of people. I didn't pay myself for the first 18 months of doing this. So
Yeah.
that wouldn't be very easy for a lot of people to do. So that
Right.
100% made it easier for me to make the jump. But I have, I have many investors and conversations I've had where people are like, you should stop working clinically. You need to do this full time, and we need to see that you're dedicated. And I have very much stuck to my um, determination to stay as a practicing physician. I do 5 weeks a year, so it's not a ton.
Yeah.
I don't think I can do less than that. But it's so important because it helps me connect with why I'm doing this. What are the problems I'm solving? Every time I'm on service, I think, oh, right, these are not only ways to make it better, but things that we need to fix and problems we need to address. So
Yep.
I completely agree with you that it takes a long time to become a doctor, and I don't want to let that go.
Yeah, and I'm so glad to hear that you're, still very passionate about patient care and about medicine, and realizing how important it is to stay in touch with that. Because that's really what made me want to have this conversation and want to get the word out there that people who are clinical, who have ideas, can have a really hard time getting those ideas out into the world, and they may be exactly the things that we need. And I sort of feel like we live in this weird state right now where a lot so I'll give an example. The IT decisions that are made at the organization where I work are made the way any big corporation would make a decision. It's like we have to think about all the nuts and bolts and moving parts and pieces of this. And I sort of think of it as the old saying of no one ever got fired for buying IBM, right? Like that's like the thing people used to say. And so it's like it's already like what they have on their plate and responsibility for is already sort of overwhelming to them, the people that I talk to. And so it's kind of like someone like me or maybe you shows up with a project that may be brilliant, but it's like, yeah, but it like, how they're thinking about it as like, how's that going to be stressful? How's that going to create problems? Rather than, they get excited, but then also like immediately it's like, okay, what are the risks involved in that? And I feel like even with some of the innovation programs, like they're just there's just not enough sort of momentum to overcome some of the resistance. And I think that's like something that we just have to continue to support each other and say like, look, probably both things are important. The people who are coming up with new ideas and like living the pain point and building stuff. And you got to figure out how that integrates into larger systems.
Yeah. No, you're right. I've seen and spoken to a lot of people in innovation centers, and I think it's great that now they're much more common in health systems.
Mm-hmm.
But it seems like they have a similar problem, which is they come up with great solutions, implement them successfully, measure, outcomes that they're excited to see, but then it doesn't go outside of the health system.
Yeah.
And it feels like we're all recreating the wheel over and over and over again in many different places. And it's a shame that when we create a really nice looking wheel, we can't easily share it with each other. I mean, there's
Yep.
obviously, from a health tech standpoint, so many foundational barriers that make it really challenging, right? Like just thinking about security and privacy and having to go through all of that part of engaging with any technology that interacts with PHI. And then honestly, the culture and the mentality of, we've spent $1 billion on an EHR and we're
Right.
not going to use anything else.
Yeah.
And then there's just, this is, you know, for a lot of clinicians, they've only learned things one way. And so sometimes saying, hey, there's another way we can do this is hard. And even as I implemented, so Trackit has like two different, I guess, functionalities. One is just making it easy to access and surface information from the EHR and make it visually intuitive. That part, honestly, I sent out one email to all faculty and staff and said, hey, I made this great thing, go use it, have fun. And it spread completely organically. It's like candy. People picked it up and started using it. That was easy. The second part, which is the workflow change and the let's get rid of paper and have shared tasks and use this to replace your rounding list, that's like fundamental to how we practice medicine.
Yep.
And so definitely different in terms of implementation, still implemented and still in use, but you see a different level of acceptance and apathy sometimes to change, and people saying like, I know this is better, but I'm too busy to learn something new.
Yeah.
I think a key element there is so many people are in medicine are distrusting that technology was really designed for them
Yeah.
and that it's actually going to make things easier. And once I could show people, like, I promise this is designed for your workflow. And if it doesn't, I will fix it. I will change it. I'll make it better to
Yeah.
fit how you want it to work.
Yeah.
And, the general concept of get people to do what you want them to do with a carrot instead of a stick. Once we show how it makes it easier, like, oh, actually, I want to use this. In fact, I want to do this other thing in this because this makes my life so much easier.
Well,
It's
you bring up a really good point that I just want to touch on before we
yeah,
move on, which is that I think there's a common shared frustration that that physicians and clinicians of all sorts are many times in today's world not the actual customers that write checks for the technology that we use. And so, so for example, you mentioned EHRs and how how that's gone so horribly wrong. And one of the frustrating things for me is like, so I don't think that they're bad technology people that are running EHRs, but the feedback loop between the person building EHR technology and me is so far removed. So like the process in my organization is like, if there's something that doesn't work for me, I sort of tell someone locally about what the problem is. They may or may not be able to do some little tweaks, but if it's something that's a bigger problem, it's sort of like, well, does that get onto the list where enough people are having that problem? And then does that get into the like, well, we're going to talk to the big vendor about it. And then if the vendor pays attention to it and wants to do something, then it may come out in an update maybe 6 months down the road from like when I'm experiencing the pain point, and their interpretation of how they should fix it may have lost. It's like the game of telephone, like something gets lost with each like step of
absolutely.
communication. So like, their idea of like what I needed is still maybe not exactly what I was hoping for. Plus which with that update, this, like everybody does, every upgrade comes with broken stuff. So it's like, you might have
Yes,
fixed one of the things I like, but then you gave me a bunch of stuff that I hate.
right.
So that process is like, one of the things that I really hope to see somehow changed, because it just isn't working. I mean, there's so much data that says that the EHR is one of the major sources of burnout, and like the current paradigm of how we're doing stuff isn't working. But what I love, so I'm going to share another anecdote. So I advise the voice AI startup Sequera. It's like an AI assistant or AI scribe, and we did a pilot with them. And immediately, one of the things I realized was like they were very, very attentive to me personally for like what was working or what wasn't. They had to be, because I wouldn't stay in the pilot. I would fire them if they didn't make me
Right.
happy, right? And
You
so
had
you have
control.
and they had we both had skin in the game, right? Like this is what frustrates physicians to no end, I think, is like, you have a problem with Epic. It's like, talk to a wall, like bang your head into the wall. Like, no one is really going to fix that. Like, you have very little say in what's going to happen there. And so part of what I love about like projects like yours is like, people are right to be hesitant about technology that's sort of jammed down your throat that you didn't choose. It's probably not going to fit right. But when it's made by somebody like you who lives in the world that you've lived in and thinks about and has similar values to you, it's a whole different thing. And
Absolutely.
it's just such a different thing.
Yeah.
Hey,
So you
Megan.
said about like, you said about
Hi
10
there.
days.
This is Sachin.
Hi.
Sorry. Hi, Subha.
Hi.
Hi, Gabe. Good to see you again.
Good to see you.
Sorry, I'm at the clinic. I don't really have a camera on my desktop here. But thank you for this conversation. I did want to just add a couple of comments about the EHR. And obviously, I don't work, I'm probably microcosm here. So I own and co-own, actually, with my physician wife, a private practice here. And but the difference is that I come from a technology background. And so for the last 5 years, I've been managing the clinic, but I also realized how far behind we are, right, in terms of using technology for the right purpose. And, the reason I'm supporting Gabe's champion efforts around physician burnout is I'm living and breathing with it. So I think one of the things I've been doing from the beginning, the best efforts in finding the right EHR failed miserably within 6 months. So we switched before it went too far. But the other one that I picked is obviously much better. But what I've done with both the EMR vendors is I was front and center loud about everything that actually is so bad on the usability, so bad on every aspect of it, right? Having built systems myself for 20 years. Yeah. But I think the one that I'm working with called Advanced MD has been a little different, and it's not a full, I don't want to say it's the best EMR there, but I'm talking about the culture of how they build products, right? They've been there for 20 plus years. So I'm on their product advisory council. They have, I think once a month or once every 2 months, where they bring in the actual users, including physicians. They have a group for physicians, and then there's a group for billers and the other users of the system. And I've been in touch with the VP as well. I wrote a huge list of issues that are impacting physician burnout. And I think the goal there is to make sure they are seeing the issues as seen by the users. Even though they claim they're bringing in the users early enough, what I've realized is it's only halfway there, right? They do bring us and say, here are the ideas on the deck. They're not implemented fully yet, but I would love to hear your feedback so we can change the course if needed. So that's the opportunity I need, right? Physicians need and users need to kind of have a sense of, we can't change, what's the most important feature you will build, but at least I want to make sure that the feature that you're building is usable and it's not adding 20 more clicks and for 40 more hours. Because very few actually
that's a really good point. And before I forget to share this, there's another physician friend of mine who's very interested in making our healthcare system better, who brought to my attention the idea that like people love to oversimplify what's going on with a process. And I'm afraid that's what happens with the vendors all too much, is they sort of have this 10,000 foot view of what me, Gabe, is with my practice. And so they would like to oversimplify what I'm doing, and sort of, they don't even know which parts of what my world is like they're missing. And so I think that, to really get to a place, because, we can give all the feedback in the world, but until they're getting sort of a higher resolution picture of like what's really going on through my head while I interact with technology, I think we're going to continue to run into this frustration. And so like Subha, like I think back to Trek It and kind of what you're doing, like you are literally thinking as a physician when you build technology, versus like giving feedback to a tech person. It's like the best intentioned tech person in the world still can get it wrong, which is like frustrating to everyone.
Yeah. The other thing I'll say is that not every physician knows how to build technology.
Right.
And not every physician even knows how to craft a process or a workflow. and they're really important, particularly when you think about how do I integrate technology into a workflow to make it more efficient.
Yeah.
So that's my plug for clinical informatics as a field, which is that I think we need more clinician informaticians who are informing how we design our products, because you have to understand both worlds to be able to do that. And I, like, to be clear, I don't do any coding, but I have to understand enough of what the technology can do to be able to then apply it to the design of what we build for our workflow. And I think what you both said is 100% true, which is that I think one of the biggest reasons why health tech is behind in the rest of our lives is then the rest of our lives is because the buyer is not the user. And that means that our demand, I guess our demand is just is shifted, right? The priority is not the same for the buyer than the user. And I actually grappled with this up front when we started the company, was, do I sell to hospitals or do I sell to physicians? And there's a big part of me that was like, I don't want physicians to have to pay. This should be something that's provided to us to do our work. But at the same time, part of me was like, maybe if you sell directly to physicians, then they get control. They get to create the demand that then drives what the companies do. Because it's like you said, if you don't do it, then they're going to leave and they're not going to use your product. And I think it's so important. The business side of medicine is obviously important. We need to be able to support health systems, and the pandemic has only highlighted that more, right? Like, we need that part of it, but there is not nearly enough emphasis on what do the clinicians need for the actual workflow. I also think what you said is 100% true, which is that I don't think people are I think most people are not, they don't have bad intentions. Yeah. But they don't necessarily know how to do the design. They're not the clinicians, and their focus is often different. If they're focusing on how do I affect the bottom dollar of the hospital, that's not always in line with how do I make it easier for a clinician to provide better care.
Right. And one of the sort of overriding themes that I've come up with is that there's sort of an imbalance of power of stakeholders in medicine right now. Like, businesses, unfortunately, sort of taken a little bit too big of a seat at the table, in my opinion. And so that's why we can have this conversation about how, like, as a physician, you can be very frustrated with your technology, but you may not be able to do anything about it. It's the technology that you're going to be using every day, but you're not the one who ultimately makes the buying decision or the firing decision. And so that, to me, is I don't know exactly how we solve that, but again, back to the AI scribe pilot, like, if someone really is your employee, it changes the whole dynamic, versus, like, if they answer to someone else, and as long as that someone else is happy enough, and as long as they're sort of the best in class, or at least competitive in class, again, like the no one got fired for buying IBM, they're going to be okay. But there's just not enough skin in the game. There's not enough, like, when I'm angry because something is broken in Epic, like, there's not an alarm going off at Epic headquarters saying, like, Gabe's unhappy. Like, right? So there should be.
How many physicians take the time to put in a help desk ticket, right? Like, the squeaky wheel often gets the oil, right? And I mean, I'm often on the floor saying, if this is bothering you, you need to submit a ticket. Or if you're having a problem and something's broken, you need to report it, because otherwise it's never going to get fixed. And, it just kind of increases that gap of who gets responded to and whose issues get addressed, because busy residents, and everyone's busy, but I don't know if it's just a culture thing, but we don't take the time in between patients to put in these tickets, and then things don't get addressed. There's
another thing that fits in here, which is the kind of the idea of learned helplessness. A lot of my friends have brought that to my attention, and it's like, I mean, it comes up in burnout, but it also comes up in this, with technology. It's like, how many tickets am I going to put in if really, like, overall it's a losing battle for me?
Yes,
So there
100%.
there has to be some sense that like things are moving in a positive direction, that like raising your voice or putting in the effort is worth your time. And like the culture that we're in right
Absolutely.
now is not that supportive of physicians speaking up. In fact, sometimes it's sort of anti-physicians speaking up.
Hmm. No, you're absolutely right. So a couple quick things I'll say about that is, um, people say sometimes, or a lot of times I hear people say physicians hate technology.
Hmm.
That's not
Not
true.
true.
Physicians love technology. We just hate poorly designed technology.
Mhm. Right.
And most people haven't seen platforms like ours that can be really great, right? And so
Mhm.
it's hard for them to believe that technology can be helpful and effective. But so I developed our EHR training curriculum at Penn so that I could teach people this is how you use your EHR and my platform in a way that actually helps your workflow instead of learning it like the way they would learn otherwise was by module instead of by workflow.
Yeah.
And I would get people really excited about, hey, let's make things better. As you start your intern year, give me feedback, not just on my product, but the EHR. Like, if you see projects that you want to do and things that you want to make better, reach out to me and I'll help connect you with someone to help do a project. And you totally see, I've been calling it learned apathy, but yeah, learned helplessness, same thing. That by like 6 months, 8 months in, they found, oh, well, getting anything changed in the EHR
Mhm.
has like a 3-year life cycle. There's no point in me trying to do it as an intern. And then they stop
Yep.
trying, which is really hard. But within our platform, so I think it's really important how you solicit for feedback and then
Mhm.
how you respond to it. So just as an interesting like tidbit, when I first did it, we had a online survey. So you could submit feedback, it would go to like a Qualtrics survey, and then they would submit that and then we'd respond to it. We got some input that way. We changed it so that you click a button and right within the app, you get a little box, you submit what you want to submit. And then as soon as it submits, it goes to my email, it goes to
I
my
love
developer's
that.
email and someone else's email. And I get it on my phone, right? So within 5 minutes, usually I'm calling that person or emailing that person and saying, hey, I got your thing. And almost always you're like, whoa, I just submitted that. You just called me back. It's like, yes, let's talk
Yeah.
about what's going on. And
Real-time
I think we were
feedback. I mean,
getting,
can you literally imagine, like, I kind of want to close my eyes for a second and imagine like if the EHR was like that, like holy cow, how that would change the world. Like if there was like a
yeah,
dedicated, immediate support, rapid turnaround feedback system like that,
yeah.
that really was dedicated to serving my needs and solving the problems.
I mean, is that too much to ask for? I don't think so.
Well, the thing is, so
I
I've
don't think
actually
so.
talked to the R&D team at Epic, and the way, like, they do a lot of things, but one of the things they do is they study how long we spend on screens and where we click, and sort of make inferences about what we
Yeah,
want from that. And it's like, okay, so that's a data set. It's useful, but like that doesn't allow you to see what's going on in my brain, and doesn't allow you
yeah.
to understand my emotions, like when that thing was happening. Like I might have been on a screen for a long time because I stepped away from my desk for a minute, or I might have been there because I didn't know what to do. Like, I mean, you have no idea.
Exactly. That's what I was going to say. I think there's a lot of confounding variables. You might be somewhere for a long time because they presented the information very poorly and it took a long time to figure it out, or you didn't know where to click next. And I know you can track with eye movements, but I
Yeah.
think it's hard without the side by side interviews to really understand what that data means. It's helpful, but it's not enough.
Have you read
Um,
anything by Nassim Taleb? I mean, he's kind of an interesting character, but like one of his books is called Skin in the Game, and I keep saying that, but I think it is so important, and it's a theme that keeps coming back. That like, if you want to make great products, I think both the product maker and the customer have to have skin in the game, and I think that's one of the places where technology for physicians. Is sort of gone off track.
yeah, no, I totally agree. Um, yeah, we could talk a lot about MVPs and how we do agile development and really try to like bring user feedback in. But I don't know if we want to talk about anything else. Otherwise, I'd
Well,
be happy to digress.
Yeah, right. I know. I'd love to. I wrote down some questions that I would like to still ask you because I have questions about them. So I wrote about this in my Kevin MD article, and I think you just answered a little bit of it earlier, which is that you started your project because you had your own pain point, and you were living in this pain point. And what I wrote about, because I was sort of exploring this, I had met another physician entrepreneur, and we were like commiserating about some of our challenges. It was like we both had this experience of like pain point. What are the available solutions that seem sort of like things we could look into? Ready, go, build, right? Like it's like just, charge forward because the pain point is big enough. Versus
Mm-hmm.
like if you're an entrepreneur who starts out by going to a business school and gets an MBA, and you're going to start a company, like before you start building anything, you're going to ask way more questions, like do market
Mm-hmm.
research, like is there a market for this, who's the customer, who's writing checks, like stuff like that, right?
Yep.
So like we sort of skip that step and then sort of have to try and figure out like who's going to pay for this, or like how does this fit into the economic system and all the other sort of systems. And so I just am wondering sort of if you have any thoughts about that, because one, I think that things that are made explicitly based off of like living the pain point are in many ways have stuff to offer that other types of solutions won't. But if you're giving advice to a potential physician entrepreneur about how to be successful and how not to feel incredibly frustrated all the time, would you would you give any advice?
Oh, that's a good one. Um, so yes, I had a similar experience where, I was knowledgeable about available solutions because I'd been working in this space for 10 years. And we knew we were going to be going to Epic. At the time we had Allscripts inpatient. I had built our prior tool within Allscripts. And so we, evaluated what all the upcoming tools were, and features, and we decided they weren't enough. So yes, we built it. But you're right, I didn't go into this as how do I build a business out of it. And if there's like one thing I've definitely learned is it's not enough to have a good idea. It's not even enough to have a good product. You actually have to have a market of someone who will buy it. I think normally, if your buyer was your user, that problem would be fine if you've built something internally and you've shown that people love it and there's great traction, because those are the people who would be buying it elsewhere. So
Right.
if I could give all the clinicians, doctors, nurses, like the ones at Penn who use this, and say, here, just pick it up and start using it, and it would already bring in their data, I have no question that I'd be able to sell that and run with it. But that's not the reality, right? I have to sell it to hospitals. I have to get the data from their EHRs, and that's where the whole buyer, not the user, becomes a challenge. And I had a similar, thing that when I started the business and started talking to investors, and people were like, well, what's your business plan? Who's your market? What are the segments you're going to go after? How are you going to do all of these things? Honestly, I didn't even know what any of that was. So I've done a lot of learning over the last couple of years, which honestly is one of the things I love about having started the business, is that it's opportunity for growth. But I guess I would say partner with the right person up front who's going to help you figure this out.
Mhm.
And you do have to make sure that what you've built, that there is enough of a need for it in the market. And then you use what you learn from what you've built internally to then drive what that value prop is. So a lot of our time has been spent, okay, what are the values that we've seen? Why is this so irreplaceable now at Penn? What would happen if we turned it off? Well, a lot of things would happen. And kind of take those lessons learned and the data that we gather from that, whether it's, and some of it is, what are the data points that a hospital would care about, right? So I didn't build this at all thinking about billing, because fortunately I don't even have to worry about billing in my workflow. I just, there are people who do the billing. But I realized that that is what drives a lot of purchasing decisions at a lot of hospitals. And so now I've retrospectively gone back and said, okay, well, have we changed billing? Have we changed these other things that have a financial impact? And we have, which is great. But that's kind of how you have to think about it, is you
Yeah.
have to think about it from the perspective of a business, and a business that is going to be purchasing when you're B2B, right? Like you have to think about the other business that's going to be purchasing it and what they care about.
I have a follow-on question that goes with that. It also, I hadn't actually read that article that I wrote for a while, but I did do my homework when I wrote it. And one of the things that I was reading about is like, what are common sort of human characteristics of physicians versus entrepreneurs?
Yes.
And so the top 3 things for physicians, like, I can't remember exactly the source on this, but it was like the top 3 qualities of a good physician were empathy, compassion, and humility. And which are, I think, wonderful qualities. I mean, those are what I want in my physician. That's the kind of doctor that I want to be. But then, like, the very top thing for successful entrepreneurs was willingness to take risks. And I was like, oh no, like, right? Like, it was like, let's see. So, probably by nature, a lot of people who are self-selected to be doctors are risk averse. Like, and then, in our culture, in our training in medical school and residency, and even in practice and with, malpractice and things like that, like, where along the way do you learn to tolerate risk as a physician? Like, we're taught to be risk averse. Like, that is, railed.
Absolutely.
So one of the things that I'm wondering about is, like, how do we, in fact, this has been my sort of big question for today. How do we transform the culture of medicine in a more positive way that's going to get us some of the places that we want to go? Because I think, like, you're building a technology solution, but I think that a lot of the roadblocks to, like, all of us using it already is, like, partly a cultural thing. And I think we need to honor, like, who the people are that are caregivers, and also, like, what kind of help does someone like me need when I have a good idea about technology? And, how do you develop mechanisms to, like, figure out where those people are that have good ideas? And I know lots of people have ideas. So, like, that becomes a problem too, of, like, maybe there's just too many, you can't pay attention to all of them. But how do you support those of us who, like, our nature isn't to be a risk-taking? Another one of the things that came up in the list was being good at self-promotion, right? Like, like, nowhere along the way, like, was that part of who I was, like, someone who's great at self-promoting. Like, thinking of myself as
that part
is, like, kind of like, no, absolutely not.
Right. So that part of your article really resonated with me. My team at the business has probably heard me say a zillion times that I don't like feeling like a salesperson. I don't like feeling like I'm just trying to get you to do something because I'm trying to make a sale. And
we feel guilty.
I have had to I feel like there's something almost dirty about it. And again, I feel like I'm getting coaching from people, and the more that I talk to other people in this area has been helpful. And I think that's why conversations like this are important, conversations to kind of help physicians and clinicians really realize that it's okay. Not only it's okay, but it's good for us to explore industry and getting what we've done out in the world. But I've needed active coaching to be like, the sales are necessary for you to improve lives. And so I guess the way I reconcile it is, what is my ultimate goal? My ultimate goal is to make patient care better and make our experience providing care better. For me to be able to do that, I have to sell, and I have to have a functioning business, because I can't support the thousands of people using my platform if I have no money to run it. Right. And then, some of the other things that you talked about. How common is that
obstacle, though? Like, how common is that sort of, like, internal limiter on our ability to promote?
I think it's really common. I think you're right. I think it's really common. I mean, I'm sure there are plenty of physicians, and I've been told there are plenty of physicians who promote themselves well. And I think they go into different fields of medicine, probably. I'm not going to name any, but I'm sure that there is a gamut. But I think you're right that the average is not the same between an entrepreneur and a physician. And, not every physician is going to be an entrepreneur. That's okay. But those people who have that aspiration, I think talking about it and teaching and sharing our experiences really helps.
Yeah.
because I mean, this was a totally foreign world to me. I was like straight through to medicine, straight through to practicing. And I mean, when I launched the business, I was really looking up every other word from every conversation. Like, what does this mean? What does that mean? I don't know what this means. And, you know, kind of learning all of this stuff, but realizing that, yeah, I have to do some self promotion. I have to talk about my product. I have to be, you know, in the end of the day, as long as we're true to why we're doing it, then I think it's okay.
Yeah.
But it takes active work.
It's really that part of it I find to be really hard. And one of the things that for me, I realized, because I did try some sales, and I, you know, might have done okay maybe, but it never came naturally. And not only that, like I found it being like one of the things that just like, that wasn't my strength. And so I guess one of the challenges that I would throw out to anybody is like, you know, at what point do you acknowledge what your strengths are, and when you need to surround yourself with other people who complement those strengths? You know, when do you bring on someone who marketing comes naturally, and they don't have an internal regulator that sort of says like, this is dirty and this isn't good, right? Like, I mean, like I've worked on myself on those exact same things, and it's so I totally resonate. And I, you know, continuing to try and grow in all the ways that I can to be, you know, be effective and helpful. But at some level too, it's like, I think reasonable to understand that we all have gifts and skills that we bring out into the world. And like, if you can maximize the things that you're really good at and also pull together a team that supports you, I guess I feel like that's incredibly important as well.
100%. And I should have said that to start. Like, I think I was focusing on the internal struggle you have to get over to kind of take this jump.
Mm-hmm.
But I mean, the next step is you have to have the team that works with you well and that has those expertise and those skills that you don't have.
Yeah.
And, you know, like marketing and, you know, some, like I don't do any coding. I do the architect or the like design architecture and the workflow architecture. But, you know, having people who have the business experience, have the sales and the marketing is huge. And you're right, like you can't, it's not a one person show by any means.
Not at all. Subha, this is really fun. And I feel like we could, this sort of happened to us last time. We felt like we could probably talk for hours and days.
Talk forever.
We'll
Yeah.
have to do this again. But in the interest of, you know, maybe allowing a chance for people who've been hanging with us to be able to interact and ask some questions, I had one more question for you. And I thought maybe we could do some Q&A, invite some Q&A. But my question for you is about mentors. And if you have any specific mentors that you would like to talk about that have really helped you along the way, and in what, you know, what ways they helped you on your journey?
Wow, this could be a whole 1 hour by itself. So many mentors, and I think mentors for different purposes.
Mm-hmm.
You know, I had a mentor, my program director as a resident, who first said, yeah, I like your idea of creating a web-based tool. Let's do it. And gave me the resources for that. To then saying, you know, I think you really need to branch out and not just do this all the time. Maybe you should look elsewhere for people who value your skills. Something, you know, someone who is really looking out for you and is willing to say the hard thing to you because they know it's better for you is so important. And I've had that both on the clinical side, I've had that on the academic side, and in multiple areas of the business side, including, like I said, someone who, when I was really figuring out how I wanted to do this, whether it was gonna be part-time or full-time, you know, it really took that hard conversation of someone being like, I would be disappointed if you were where you are in 10 years. Like, you need to be able to do something more. It's like, oh, okay, I wouldn't have thought that myself. So getting people all along the way to mentor you for different things, I think, is incredibly important. How about you?
Oh man. I mean, I think so. The reason I asked that question is I first of all, I think that, you know, in doing this, I've realized that, that even, this conversation in a way is a type of mentorship to me, right? Spending time with other people who have had experiences, and like, you're just showing up because we have common interests, and we're humans that are like trying to figure out how to get to a better place and how to live in a better world. So I think that actually one of the ones that's sort of a funny answer is that I feel like in a way so for me, I live in rural Montana, and I have a lot of people that I can name as humans that are mentors. But one of the things that has really enabled me to have a lot of mentorship is the internet. It's like we're talking because we met over Twitter, I think.
Yeah, yeah.
Yeah. And and actually a lot of the projects that I have become friends with people, and we've worked on something together, and they've shared their wisdom with me, has been through networking and the gift of the internet. So I mean, I think partly so I love living in rural Montana, but I also have this insatiably curious brain that like needs to do something and talk to people. And so like it might mean more to me than it does to someone who's in a city, for example. But I guess that's one answer. The other is I seem to sort of go in periods where like mentor is more impactful for me than another. The mentor that I am really paying attention to right now has been helping me with a current project I'm working on, which is actually a new physicians organization. And the mentor is Dave Logan. He wrote the book Tribal Leadership. And his background is in studying organizational culture. And his mentor was actually the same guy who was the mentor to Howard Schultz, who's of course the guy who did Starbucks. Warren Bennis is the guy. And so what I have found is it's incredibly interesting to have people want to pay it forward, and that's actually part of what I would like to do. I think that that's one of the antidotes to our suffering is paying forward things that others have helped us with. And in fact, I wanted to share something from Dave that I've been pondering a lot. He wrote this book also called Laws of Performance, and there are 3 laws, and it goes like this. Law number 1 is how people perform correlates to how situations occur to them. And I'll bring this all together. Law number 2 is how situations occur arises in language. And number 3 is that future-based language transforms how situations occur to people. And so basically what he's saying is we live in a current paradigm. We've got some things that are working well and some things that are challenging, and sort of our experience is the way we see and interact with the world, and our language, how we talk about things, largely shapes that. And literally the words that we use can change the way things go. So one of Dave's exercises is to think about like, he calls it the default future. What is likely to happen if we don't do anything different than what we're doing right now? And he also talks about an invented future, which is like, if we think about a better world that we want to live in and how we might intervene to get to that point, what would that look like? And how would we change our language so we move in that direction? And so one of the things that's hit home for me is going from a sort of self-centered, like things I have to do, sort of where things are the weight on my shoulders to change something or work on something, to a very more we-based language, and being part of community, like being part of, like, I consider everyone who's actually here on this call, even though there's not that many of us, like a community of people who are, are interested in health tech innovation. And if we start thinking about like how we can help each other in a culture of we rather than a culture of I, and really leaning towards what is important to all stakeholders rather than certain stakeholders, that's an example of how changing language potentially could change the way things happen. And I'm very interested in that. So that's
I love that.
a little bit, a little esoteric in a way, but also very real to me.
No, it's great. I talk all the time about how the words we use matter, whether it's orally or written. They impact not only how we think about what we're talking about, but also how people interpret what we say and then what they think about it. So I think it's great.
Awesome. This has been fun. And so I, can we open up and see if anybody would like to interact a little bit? I see Tyler, and forgive me if I say names wrong, Rena, Joel, Sashin, like any of you are welcome at this point. If you would like to ask a question, you can type it in the chat. You can unmute yourself. Please feel free to jump in.
Hey, this is Rena. Can you guys hear me?
Yeah.
Yep.
Awesome. First off, thanks to the two of you. Really great discussion. Appreciate both of you sharing your experiences and just wisdom. So very much appreciated. So on that topic of wisdom, you know, both of you being physicians and in the clinical world and entering the space of business, you touched on this a little bit, and I think even around mentorship, you know, that's part of the answer. But, you know, what did you do to fill big gaps in areas of business? For example, you know, earlier we said marketing, for example. You can't always hire the expertise that you don't currently have. So what did you guys do, or what are you looking to, or what do you currently do to fill the gaps where you can't necessarily hire in the expertise, but you may not know it yourself, but be able to do it quickly so that you can get that filled for your business?
That's a great question. I'll take the first pass at it. So first of all, I am not a wildly successful entrepreneur. I've been part of 2 failed startups, and I'm advising one startup that's actually still going. And I'm involved in more of actually a cultural effort now with a nonprofit. And so you have to take a little bit of what I say with a grain of salt. I'm not the billionaire tech entrepreneur to answer that question, but I think that on my journey, the part of it is being in it for the long haul, because I have a network now of people that is really robust, having been doing this for, we started really in 2012. And now, so in terms of marketing, I have a friend who, his profession is high level marketing. He's the guy who named the Venus razor, and he told me a really funny story about how all that happened. And like he will help me anytime I call him and give me professional advice about marketing. And you know, I mean, he's a friend of mine, and that's just because I've been doing this for so long. And we actually met through working on a project through Practicing Excellence together and became friends. So like, that's one way that things like that could happen when you don't have a lot of resources, is that if you go to places where your passions and values align with other people, sometimes over time you develop friendships and connections that are incredibly valuable.
Yeah, Rena, that's a great question. I think it depends on how you end up structuring your venture. So in my case, I partnered, you know, with someone who had experience in business, and we raised money initially from friends and family, and then from a venture-backed group. And that really is what drove our ability to hire. But, you know, every person you hire shortens your runway for the business. So it's a delicate balance. And I think really about figuring out what skills you need the most and most time dedicated towards, and then prioritize hiring those people. And then what skills maybe you don't need as much of, and you can consult or find friends, like you said, to help. But, you know, at the same time, as a startup, it's all hands on deck and everyone needs to do everything. So I think as much as we can, we try to learn and do everything ourselves. But there's certain things that, like sales, I think is a really good example, and business operations, like, you know, doing things quickly and effectively and already knowing how to do it. Those are 2 areas that I think have been most valuable to bring other expertise in, maybe because those are my gaps. But I think a lot of it starts with knowing what your strengths and weaknesses are.
I'd also love to see your bookshelf, Subha, because like for me, you know, whenever it was like I don't know anything about sales and I don't know anything about marketing, it was like, okay, what book should I read first, and then what other book is out there? So I actually, like, the first one that comes to mind is there's one called To Sell is Human. I think that was a Dan Pink book that I read early on because I knew that selling did not come naturally.
Oh, I'm writing that one down. To Sell is Human. Honestly, I do a lot of audiobooks and digital books, but I was reading Lean Startup, and then gosh, now I just forgot this other one that I was just reading, but I've been listening to some podcasts. So High Growth Handbook
Mhm.
and some other ones about really kind of challenger sales. Yes, that's the one I've been reading. Is just think I think similar to medicine, having a framework for something that you do is really helpful to figure out how to do it if you're not familiar with it. That's something I really like about the challenger sales book, is that it's actually saying like, this is how you approach it. Here are steps, and then I can kind of apply that as I learn about it. But
That's awesome.
as we said, reading about the things that we're not as strong on. So
And podcasts, I'm going to put a pitch for Masters of Scale. I feel like that
yes,
podcast by Reid Hoffman is amazing. If anyone hasn't discovered it, Lean Startup that you mentioned, probably everyone knows about, but that's sort of required reading.
yeah, no, it's great. Awesome. Well, this was wonderful. Sachin, I don't know if you want to say anything else before we hop off. Appreciate you joining.
Just
Or
one
Rena.
question. Thanks again for sharing your knowledge and wisdom here. I think since I'm not a physician, obviously I can see the perspective that you share, but the part that I always, I've had my own startups. I still have one that I'm running while I'm running this clinic. The challenge I've seen with the healthcare, as much as it is in dire need of more innovation, is especially in the ambulatory setting, right? Like where we are, it is so the biggest obstacle for us really is the EMR, right? Because it's not like an open, and I'm sure there are a few EMRs that are open APIs and everything is open up, so you can actually build your own apps to make your life a little more productive, right?
Yeah.
That's where I see the biggest challenge. I have a lot of ideas where we can improve the lives of physicians in terms of being productive, in terms of less burnout, etc. Because all data is buried in here, right? Even if I want to improve the preventative measures and how good I can meet the HEDIS and more drive towards value-based care, all of the good stuff, I want to do it, but I just can't because it's all buried in there, and I have to manually pick patients up one at a time to do it. So for you, I can understand, I think your target being hospitals, it made so much sense for you to kind of, it's a smaller, obviously, a landscape versus dealing for, if you have a solution that can be suitable for ambulatory, you have a lot bigger market too. But it's a huge challenge because you have 300 odd EHRs to deal with. So my question to you is, how do we approach something like that? And I can't, there are a lot of consumer apps, obviously, I can get data out for consumers and do something for my consumers, for my patients, but that's not where we want to go. I want to help other physicians leverage what you're building, like what Gabe did and what you did in a way.
Sachin,
Yeah.
I dropped something in the chat that you and I should talk about open EHR. There's a physician from Scotland, Ian McNichol, that he and I became friends after I shared something I read in a journal article from Harvard, and it was this physician informat. You say it, Subha, informatician.
Informatics.
So who basically like outlined how the architecture of how our technology should work really needs to change, and we need to be in a system where like basically like the EHR is more like a database, but then apps are built on top of that.
Exactly.
And sort of
Yeah.
can freely
Like
share
an
information
ecosystem can
with
be
an
built
API.
around it, right? Yeah.
Yeah. And so anyway, so he engaged with that and told me about open EHR, which is much more popular in Europe than it is here.
Mm-hmm.
But there are some small projects in the U.S. and essentially what it is it's a data infrastructure for health technology that's built with the ideas of kind of getting the groundwork right, so you could build applications on top of that.
Okay.
And the one of the limiting factors to us having that here is that to kind of have an instance of open EHR going and keep it up to date it requires a fairly significant amount of resources.
Yeah.
And figuring out like how you're going to commercialize that and pay for those resources is a little hard. So Ian and I were talking about like, who could sort of spearhead a project like that, because what would be interesting is that could really unlock some interesting interoperability things as well, which, you know, that gets into a whole other conversation of like why interoperability is so hard, like partly technologically, partly politically, partly, you know,
standards,
on and on and on and on. But so open EHR is really interesting. And, you know, when I think about, you know, there's the current state that we live in, we all, I think on this call know that there's a future state where technology works together in a much better way, and data isn't so siloed and so hard to do with it what you want.
Yeah, two quick comments. I lost my train of thought, but the first thing was about what something just fell off my door. So you know, I built this originally as a hospital tool, but realized when I started the company that it's actually very applicable outside the hospital. And so now we have people using it for home care visits and in ambulatory and in the post-acute care setting. But I think a key is what you said and what Gabe said, which is that EHRs are like this foundational data element. They have a lot of important functions related to that they do. I don't want to replace them. I'm not trying to get rid of the EHRs, but what I do is I integrate with them. And so I make any EHR easier to use, because the reality is changing your EHR is hard, right? And there's a lot of stuff tied in there, and they purposely make it very difficult to do that. And I think there's also an element of you need to have an agile workflow tool that can respond very quickly, like we were saying, to what we need and the changes that we make. Like within 2 weeks of COVID, we had templated bundles for to-do lists, for progress notes in Trekit. We had a COVID flag. We had a COVID filter on the labs. It took months for that to come into the EHR. So you need something that can be flexible.
You know that you, like, if you're not already working on this, that you already like invented another company, which is like sort of like an agile based like technology module for EHRs, where like there is that box where you say like, you know, what is your problem right now? And there's some immediate feedback that's tied into solving your problem.
Yeah. That's really smart. I mean, it's basically what we do is we say, what are the things that are we're having a hard time with in the workflow? And then we can take the data that's in the EHR and make it fix that problem. The other thing is when it comes to interoperability and accessing all these things, you know, we have somewhat of a model with HIEs. I think it's challenging, and there's a lot we can do to make them better in terms of, you know, ideally this concept of a national HIE instead of regional is I think a goal that we're working towards. But what I'd like to see is that HIEs are able to partner with companies like ours to then make that data usable. Because again, what happens is they've become pipes to share data amongst their members. But if you don't have a good way to view that information, then it's not very effective. So we're actually starting a pilot with our HIE here, the Health Share Exchange, where we are going to pipe their data in to Trekit so that anyone in this area can say, oh, I want to look at the HIE data, but within Trekit's UI, because then it's a completely different way of actually bringing interoperability to our EHRs. So hopefully we can find ways to bring some of those concepts into our industry.
That seems like that's the next wave of like of how this needs to go.
Awesome. Well, we're super over time, but I think I could keep going easily and talking.
Like we talked about, we could probably jabber on for a very long time. So should we end it for today and say thank you to everyone for coming?
A question: is this something that happens every month or so? I just saw it happen on Twitter, but I wasn't sure.
This was the first time, but actually, I mean, I think it'd be interesting to have like a regularly scheduled program where we talk about physician innovation and challenges and opportunities. That would be really cool.
Yeah, I'd love
it would be great because we could hear more about what you're working on, and I sort of like the idea of highlighting, you know, one person's project and a group of us sort of being there as moral support and other support to sort of listen and you know, potentially try and help if we can.
Yeah, like a roundtable.
Yeah, definitely.
Great.
Well, I appreciate your time.
All right, we'll make it happen.
Awesome.
Thanks.
Thank you.
Bye, everybody.
Yeah, it was awesome.
Thanks,
Bye.
Serena.